I'm having us go live link so you can start when you're ready, and then I'll do one other thing while I'm doing that. So.
Okay.
But you're good to start.
Okay. Good evening. We're starting the Free Access Committee meeting for February 13th. First line of order of business is to adopt the minutes from the January meeting. Could I have a motion to do that?
Sure. I motion that we adopt the meetings from our March meeting. I can't remember what day that was.
January meeting?
Oh, January.
Yeah.
That's what I meant.
Time is moving on. Time is moving on.
From our January 2025 meeting.
I think Derek was not ready to adopt that one
Second
yet.
that one? No?
But let's go ahead.
Jump in time?
All in favor?
Yes.
Okay, thanks. Good evening. We have one of the things we want to do tonight is to have a discussion with the Montgomery County Hospital Collaborative, and Kate and Joyce, you're both on tonight. I don't know if you're going to lead the discussion, Kate, but why don't you proceed however you want to?
Sure. Well, thank you, everyone, for allowing us some of your very precious time. We appreciate it. We have some slides. Would it be easier, Niles? I think you have them, or I'm happy to share. Just let me know.
Yeah, so I put them up on the screens. Here, let me see if I can share.
Yeah, I was going to say, we can see them on our end.
Yeah, we can see them.
So let me do this. Let me try to share it from this side. Give me 1 second, okay?
Yeah, no worries. I'll introduce myself in the meantime. I'm Kate McGrail. I'm from Suburban Hospital. I'm a program manager for community health improvement in the Department of Community Health and Wellness. And I'll let Joyce introduce herself as well.
Hi, good evening, everyone. My name is Joyce Zebo. You might see Chinyere at the screen. I am the Community Benefits Project Manager at Adventist Healthcare, and I work also with our Montgomery County Hospital Collaborative team.
Yes, so we represent 2 of the 4 hospitals in the county, or 4 systems in the county, 6 hospitals. And we're here to tell you tonight just a little bit more about the process by which we do all of our health improvement work, which is called a community health needs assessment. And we're really lucky to have the resources and the collaboration of our hospitals here in the county, which is really unique. And so if we go to the next slide, we'll give you a brief background of what a needs assessment, or you'll hear me say CHNA, is. And so the most important thing to know about a needs assessment is that it's intentional and it's systematic. And it's helping us identify the most pressing needs of a population or of a community. And we are currently in the first stage of a 2-stage process. So the CHNA is stage 1, and the second stage is the implementation plan. The CHNA tells us what the issues are, whereas the implementation plan tells us how we will address them. And as public hospitals, we are required by the Affordable Care Act to conduct this process every 3 years. So the last time this was done was 2022. And did I hear something? So there's a lot of steps here outlined. You can look at those at your leisure. We're going to kind of highlight some of the most important stages that relate to you throughout this presentation. So if you want to go to the next slide, I'm going to show you what distinguishes the CHNA from other processes. And so this slide has some key principles that really help us stay in this very public health focused framework. And so part of the guidance that we have through the Affordable Care Act, specifically through the IRS Section 501c3, not to bring more, boring things to this process, but it does tell us that we have to take into account input from persons who represent the broad interests of the community served by the hospital facility. And so that's where you come in as stakeholders and as advocates for the community that you serve. We want to make sure that your voices are heard and that your input helps us consider those local conditions and to develop very targeted strategies to address your needs. And so we'll go into a tiny bit more detail later, but we can take your input in several different ways. The CHNA allows for surveys or questionnaires, focus groups, town halls, and the like. So, and we call that primary data collection, and it's called primary because you, as community members, are end users of hospital services and county services. So that's the primary element of the data that we collect, but the secondary data collection comes from indicators in the community. And so those are already existing data sources. One example is our hospital census, which tells us who's coming in and why are they coming in, what conditions bring them through our doors and into our beds. And then we also look at other indicators such as local, state, or national level information that helps us identify where do we stand in terms of like the context of time, location, and demographics. So between those two sources of information, we're kind of going to sort through it to help find the needs, the highest needs. But really important here is the intentional application of health equity. And we're doing this by diving deeper into areas specifically designated by Montgomery County as equity focus areas, as well as geographically isolated areas. And that's why we're here tonight. But this doesn't mean that we aren't looking at the county as a whole. Yes, we are. But we know that to apply equity, we have to really pay a little more attention to some areas or voices or populations that are traditionally more overlooked. And so I'll keep going. I know we want to keep on time and we will absolutely save some time for questions. But on slide 4, the next one, I want to tell you a little bit more of where we are in the process now. So we're listening to the community. This past fall of 2024, we had a council of community members that we call the Community Engagement Council. It was about 8 people representing the Ag Reserve and the equity focus areas. And they were really just lay people who are also leaders and advocates representing their specific communities. And so that's where we met Heather Witt, who was able to put us in touch with you. And she was really influential in helping us develop, strategies to reach out to specific isolated communities in the upper and western part of the county. And so we're continuing to listen to folks across the county now that specific council had given us a plan, and now we're implementing that outreach plan. And so specifically, we're here to ask or to share more about the primary data collection period or process specifically. And so we have a couple tools that we've developed to gather data. One being a brief and anonymous survey that's been developed and translated into 6 different languages. And we'll outline what's on it in the next slide. But in the spirit of equity, we know that not all individuals are comfortable or equipped with taking a survey, especially electronically. So to the extent that hard copies are more applicable, or if a focus group, a small group conversation would be more applicable to certain communities, we are absolutely available to help with that as well, make that happen. And so that was part of the data gathering portion, and then we will also kind of thread what we hear directly from the community with what the data analysis from the indicators are saying, and be able to prioritize what the greatest needs are. And that really depends on existing assets, existing capacities, partnerships, because as much as we would love to do everything that we hear about, we just can't. And so we will be partnering with the county on this final phase to develop strategies where we can really create impact. And so now I'll turn it over to Joyce.
Okay, next slide. Okay, so now we want more participation in our CHNA process. And so we're here today to tell you specifically how that action can occur. And we're inviting as many people as possible in those geographic locations to take part in the survey. And we're encouraging you and all of your network to make sure that as many people hear about the survey and all the stakeholders would be able to spread the word. Our timeline is until the end of February, which by March 1st, we should be ending. So we would like to try to get the word out as much as possible. There are ongoing ways to get involved, which would be work groups, focus groups on the key specific areas that Kate had touched upon. And also the groups would also be included in different county stakeholder and government agency work groups as well. So we are looking to put our campaign out there. If you have social media, you have any of the areas, any specific subgroups that you think that the barriers of health would apply, that we would like to be able to share, get their thoughts. Next slide. So opportunities to take the survey to promote it. We have flyers. We are asking for our stakeholders to put the information on their listservs and on their websites and to partner with us so that we could be able to collect this information. There will be a final report after we collect all of the data, and that would be publicly available by June 30th. So it will go through an approval process through all of our hospital boards and our directors, and we will also have an opportunity for public comment and feedback. So our priority is pretty set as far as moving forward with our implementation stage to figure out how to address the needs in CHNA once we gather all the data and be able to find those focus on those priority areas. So we are inviting everyone to engage throughout this process, and no matter what involvement you are able to engage in, we would like to be able to ask for everybody's partnership, and we will also provide updates in September when the final results of the CHNA and CHIP are available. Are there any questions?
So you mentioned, I think, two things here in terms of getting input. One is the survey, which I assume there's a link or something that we could share and reach out to groups we know and individuals and promote it on our Facebook page and that kind of thing. But then you also mentioned a focus group. How does that get done, or is that going to happen, or I'm not really clear on what that part looks like.
So at the end of the survey, because we still have the implementation process, so we are going to take a deeper dive at the end of the collection of the data, and we will develop our focus groups based on, we at least have those who have participated in the survey that we could reach out to for focus groups, and also ask all of our stakeholders if there are individuals who are available, or if there are platforms that we can come and actually form these focus groups on. But it would be at the end.
Okay.
Does that answer your question?
When would the focus groups take place?
They will take place, and we haven't established them yet.
The next slide actually is
Okay.
the timeline, and I can point out what
that'll help.
Joyce is referring to. There you go. So in the June to September is the implementation strategy period.
So that's when the focus group, that's when you would organize focus groups and dig deeper.
That's right.
How do you draw from the people who fill in the surveys if the surveys are anonymous?
So we would go back to stakeholders, the organizations that put out the survey, and just ask them to re-invite
I see.
interested parties.
I see. So, okay, got it. Thank you. I'm looking at the value, the one virtue of doing this from not being there is I'm actually looking at the survey right now while we're meeting. So just for the rest of the committee, if you haven't looked at it yet, it's
How do we access it?
thorough, but very, it won't take a long time. I mean, I think it's pretty clear and easy for people to take. So we could, I think we could easily circulate it and confidently say this could be really helpful. And in fact, one of the first question is asking about the top 3 issues that affect your community. And one of the options is living far away from resources or services. Mm-hmm. So it would be good if we could get people in our area to be filling it out if they, if that is in fact one of their main concerns.
Nancy, where did you find the link for it?
I looked at Kate's, now I sound all weird. I looked at Kate's Facebook page and she had posted it there.
Okay.
I'm sure Kate has a more direct link.
Could you email it to us, Nancy?
Yes.
Thank you.
We will definitely be able to share all the materials with everyone.
And we actually also have a really comprehensive list of stakeholders that Heather Witt did put in her community plan during her time on our council. And so I will share that with you as well for your feedback, because we know that sometimes the ask and who it comes from matters. So as much as we don't want to add work to your plate, you can let us know, oh, we're going to reach out to this group, this group, this group. They know us inside and out. And you can say, oh, but you can, Joyce and team, Kate and team can complete the rest of the outreach. And we're happy to make that work as well.
Yeah, that would be
also,
great.
if there are any subgroups that may not be identified, because we are really trying to identify those gaps. And so if based on your expertise, if you could also add to the list, that would be great.
Okay.
Yeah, that, I don't know if you are familiar with, in 2023, the county did an LGBTQ survey report, and there was only one respondent from the Ag Reserve. So that's a subgroup that has often been very overlooked in this area. Anyway, so I really appreciate the opportunity to kind of look over the list of stakeholders and see if there's some additional groups that we can help facilitate communication to.
Thank you.
So,
And as Joyce mentioned, the survey is the immediate ask and the promotion of it, but throughout the period, and if you guys want more consistent engagement with the process, there will be another call to action to stay, and that's kind of what we were completing this last slide with. It doesn't have to be one survey every 3 years. It can be a little more ongoing as we develop these implementation work groups, so that you can also remain engaged in the solutions that come from this.
so just to, again, be a little more clear on the time frame, you said, it says public comment period to June 2025. But you mentioned too that the survey is supposed to be completed by the end of February, is that correct?
Right. We did an accelerated review of the whole process. Back on slide 2, there was that circle with a bunch of different steps. So we're collecting the survey data now, so February 2025.
Right.
We have a few more steps to complete before the final product is delivered by June.
So I have 2 questions. One, just sorry, I wanted to clarify. I wasn't looking at your Facebook page. It was your LinkedIn page. Are you going to send the links around, or do you want me to?
We'll send them.
Okay, you'll send everything around. And then I'm wondering, is it possible when you're doing focus groups to plan a group for this area?
Absolutely. So the focus groups, as they align with the implementation strategy will be based on, likely areas of access to care, healthy behaviors, and another category that's a little bit more like social determinants of health. So you would likely want to be part of the access to care group, or you could, be on all of them if you like, where it relates to equity and access.
Is Heather Witt going to continue in the process as a representative from this area, or is her part done?
She was, her involvement on the council is done.
Okay.
But anyone is invited back. We will certainly reach out, and if she chooses.
So are you looking for us to help promote, and I gather that's what that is, as much input on the survey and try to get people to respond to it as we can?
Yes, please.
Okay.
So whatever fits the communication methods or modes that your community prefers is how we ask you to do it. So there might be existing events where there can be flyers up, and we have flyers. There might be listservs. There might be people really prefer social media or WhatsApp group chats. You know best. And if it involves direct emails, like I said, Joyce and I and our team, we are happy to make those happen. If you think people would understand, like, who is this inbox name that we don't recognize versus yours. So if you could give us a little bit of that guidance once we share the list, we'll be happy to collaborate as needed.
And I also want to include, we do have a small little FAQ sheet to just kind of give a quick summary of everything that we talked about.
In the past, the town actually has an email system of, I think about 1,700 people have signed up. And we've actually used that because people have signed up to get notices. So that could be one way we could get out. And that's a pretty big audience right there.
That would be incredible.
Niles, what do you think about that?
All right, there we go. Yeah, no, that's not a problem. I was thinking we can put it out
And put it on the website.
Yeah.
and put it on the website. That's not a problem.
Right.
So my question for Kate then is, so it's the 13th today. So are we thinking about putting something out? If you have things, I can put it out maybe tomorrow in the email I was going to plan to write tomorrow to go out. Is that reasonable timeline, or do we want to do it a week from Friday or something like that?
We could have the documents in your inbox tonight.
Okay.
And what about our muster
Yeah.
email list?
Yeah, we also have,
Ag Reserve.
the Fair Access Committee actually has what we call a muster system, where we actually have people signed up to be members of the committee, and we can send it out that way too. So some of those are duplicate, but I don't think it'll hurt
Yeah.
anything. So. And then, of course,
That's
we have
pretty generous.
we have
Thank you.
Facebook too, which you can use. So there's multiple avenues, really.
Will you have like a brief, like one paragraph, like description of it already? Something that we can say,
This is
this is what it is?
Yes.
Okay.
And probably more important is, this is what it is, but also why it could be important for them to participate. What is it that the community might be able to expect to get out of this if they participate?
Yeah, we have a really nice flyer
Okay.
that gives the summary, the link, a QR code if you want to hang it up. So
And is this also geared towards youth, like high school age, college age, or is this more adult? Like, is there a,
we're asking for adults at this time.
so 18 and older?
Yes, but if there's an adult who represents a youth group, that is a good response to have
Okay.
as a stakeholder.
Just to give us an idea, because you said this was done in 2022, the last time. What kinds of, give me some examples, or could you give some examples of the kinds of things that the plan actually resulted in terms of initiatives that help the community health-wise?
So the emerging needs that were really evident in 2022 compared to prior cycles was now the inclusion of social determinants. So non-health conditions, non-diseases, which was the traditional outcomes before. And so now we're looking further upstream at the social and environmental issues that we can address, such as workforce and labor shortages, income inequality, housing cost burden, and of course, transportation might be something that your folks are really interested in as well. Then we have strategies focused on healthy behaviors and how do people make the best choices for themselves, especially regarding like chronic diseases relating to obesity, so food insecurity and lack of physical activity. And then, to no one's surprise, access to traditional care, such as primary care, behavioral health, and insurance.
Okay.
And so these, we'll share the link. These are also required by the Affordable Care Act and the IRS to be publicly available at all times by all hospitals. And so this is the second cycle that we've done collaboratively with the Montgomery County Hospitals. So you could go to any hospital site and find it, but we'll give you the link on the chance that you would like to review the methodologies that we use, the background information, but we did our best to summarize it really briefly for you, but there's so much more. And the exciting part is the inclusion of the county this year. So not only are we collaborating with the hospitals, but DHHS has requested to also be part of this because they too completed their CHNA cycle recently. And so we've decided to join forces at the implementation stage to say, you know, where can we dive deeper and broader in some of these issues that we're seeing across the county. And so all the more reason to stay involved and kind of build the networks with the county as we develop these strategies. The hospitals continue to work on them every 3 years. The county is a little bit different, but we'll be completing this every 3 years.
On one example, obviously, you mentioned this, and obviously it's, for us, pretty critical, and that, you said transportation. What kinds of things could actually come out of this that might help in that area?
We will know more once we see the current data and the feedback. So we're not at that stage to be able to like really get deep into a response yet.
Okay. So partly you're going to need evidence that there's a critical need that's missing, like transportation.
Right.
Okay. Got it.
So if it's not identified in the secondary data, we really need that much more input from the primary sources.
Right. Okay. Anything else? Sarah?
I'm gonna look over their previous report and get a sense of.
Yeah.
Awesome.
Yeah.
Thank you so much.
I'll make
That
sure
was really
all of that
helpful.
is on at your fingertips in one comprehensive email to Niles and Link. And Joyce will be there too, so you'll have all of our information.
Okay. Yeah, I'll get it out to the committee too, so that'll be good. All right. Anybody else have questions? Nancy, any further questions?
No, thank you.
Great questions, and thank you. This was a lot in a little bit of
It is. But I see where you're going with it. I think we can help, so we will certainly get on it.
Really generous. Thank you so much.
Good. Thank you.
Thank you.
All right, good night.
you.
Thanks, Joyce.
Have a good night.
Good night.
Have a good day. Bye.
Okay, originally on the agenda, I mentioned this to Sarah and Derek, but we were going to have a discussion about the high school playing fields. But I got a text yesterday, day before yesterday, I guess it was, whenever the schools were canceled. Gina and Ed had scheduling issues that came up because the schools were canceled that day. So they had, I think other things had to be done, and they just, scheduling wise, couldn't do it tonight. So we're going to have that discussion at the next meeting. Alan Hobbs is part of it too, but so that'll be for the next meeting. The other thing, Nancy, is you had a couple things you wanted to mention in terms of the update from what you're doing with the committees, and you mentioned Abby, for example, the conversation I had with her, which sounded interesting. So if you want to update us on that, because there may be a discussion with Abby, or I guess you also had talked to Linda Burkowski
Linda,
about
yeah.
coming as well, so.
Yeah, so as you know, I reached out to a number of people who are living in our region and currently serving on county county boards or committees. And for two reasons. One was to kind of ask them to flag for us if there were going to be openings on those committees where we could try to find some people, but also to make sure that they were kind of ready and willing to partner with us on, sort of supporting each other's work. So Linda Burkowski, who's on the Commission on Aging, was glad that we reached out, and she's interested in talking with us about the kinds of things she's currently doing on the commission related to fair access issues. So she's going to join us for the next meeting, the March meeting.
Right.
And then they also, as you know, have vacancies with a deadline of tomorrow. I talked to Maria from the Poolesville Seniors. She brought the call to her board. They had said that they would spread the word among their community. And we also put out a post on Facebook. I don't know if those efforts have yielded any applications, but Link and I talked and thought, that was sort of the right level of outreach for this round, at least.
Nell, did you have something?
I wanted to make a comment, Nancy, just on our back and forth with the Facebook thing.
Mm-hmm.
I ran into an issue where, because it was in the group, it wouldn't let me share it outside of the Facebook group.
Okay.
So that was going to be my question to add to tomorrow's email, is do we want to add that language in as well? So I do like a fair access updates, and one would be what we just talked about, and the other thing would be that. But I just wanted to check in and see if that makes sense.
Yeah, so the aging deadline, deadline for the aging one is tomorrow.
Okay.
So I guess if it goes out really early in the morning,
Yeah.
I guess. But maybe the better thing is just to take the language from that just points people to the page where there are where the vacancies are listed.
Yeah.
Just to get them start to get people in the mindset to check that periodically, and to kind of be on the alert if we put out notices in the future. Does that make sense to others?
Yeah. That's fine. Like, I tried to do it, and then later they were like, nope, you can't do it because it can't be seen outside of the group. And I was like, okay.
Yeah. So then the other thing is, I met with Abby Klaus Radigan yesterday. She serves on the library board, and she's a school librarian, but she reports that there are two people who are on the board because they're librarians, the head of the Montgomery College library system and the Montgomery County Public Schools library. She just happens to be a librarian who volunteered to serve. Mostly it's citizens who are interested in the libraries. Apparently the way it works is each individual library, including ours here in Poolesville, has their own advisory committee, and the people who are on the board are assigned a couple of libraries with which they liaise. So she goes to the local library advisory committee meetings for Poolesville and for Quince Orchard. But she joined in September, and so far there hasn't been a local Poolesville meeting. They haven't really been able to pull it together. Right? Mm-hmm. So she's waiting to go to a meeting, hopefully soon. So because of that, she's not yet sure of all the kind of relevant fair access issues. We talked about some of the things that she's going to try to learn about in the meetings. Are there are the hours too short here compared to elsewhere? Do we need more space for the kinds of community events that a library should be able to hold? And we talked about how we will have the community center coming, but that's of course still several years away. And there may also be some things that really should happen at a library, not just, at some community space, but specifically at a library. So she's going to kind of think about those issues when she starts going to those local meetings. She said that there's a new head of the Montgomery County Library System who's very good. The person came from Baltimore, so she's used to working in a kind of big system like this. And that person came to the library board meeting, shared her view of access. She's interested in access issues. So Abby's going to tell the library board about our committee. Absent anybody telling me I should take this back, I took the liberty of telling her that we would be happy to talk with their library board or the new head librarian if that would be something that's of interest to them. I'll mention one other thing that I thought was interesting is that apparently one of the things that this new head librarian talked about was the fact that libraries are increasingly being used to help the unhoused and mentally ill population. And so she's interested, this head librarian person, in having social workers on staff at local library branches. Now, the reality is that desire for new things like that, as we talked about, as we heard this morning with in the meeting with Kate Stewart, there's probably not a lot of room for asking for new things like that in the budget right now. But that is something that is on her mind and she's thinking about. So, if that evolves into something real, there may be, I could imagine some ways of sort of resource sharing with other entities in the local area. So something for us to keep in mind, probably not right away, but maybe over time. And Abby did suggest that we might consider having a fair access member join the local library advisory committee. So that could also be an option. She said she doesn't really know exactly how it works, but she doesn't know of anybody who wants to join who doesn't get accepted. So I guess it's not a high pressure.
When you say local advisory committee, is that the one that Abby's on? Or are you saying there's one?
No,
more
she's on the
specifically
county library board.
Okay.
And each library, so the library
So just for our specific
here in
library here.
Poolesville has an advisory committee.
Do
So she goes to that as the liaison to the library board. She's also,
Do you have any idea who's on the board in our local one?
I don't know.
Okay. How big is the board, by the way? Is it?
I don't know anything
Okay.
about it. And she didn't know a lot about it either because, again,
Okay.
they've canceled every meeting they've had
Oh.
since
So they
she
haven't
was
had a
born.
meeting for a while is the issue then? Okay. So does the the librarian here, do they head that committee and run it? Is that what happens?
I really don't know how it works.
All right. Well,
I mean, she told me how the county one works.
yeah.
And she's going to know. So she's, Link and I talked about, she said she would be glad to come and talk with us. So I had suggested, why don't we wait? First of all, I knew we were busy today and at the March meeting anyway, but I said, maybe the best thing would be after she's already gone to one of these local meetings. So Link and I talked, I just sent her the date for the April meeting to see if she's available then.
Okay.
I don't think I've heard, I have some messages here. I haven't heard back from her yet.
Okay.
But the hope is that by then she could answer all these questions that we have about the local advisory committee too.
Because it just, when you mentioned all this, Nancy, I just forgot all about this. On Poolesville Day, at the booth, I've got her card at home and I've forgotten her name, but the librarian now that's there, the new
I was there with
librarian.
you for that conversation.
Yeah, she's really very outgoing and really wants to do more with the library. But she mentioned a number of things that our library doesn't have that other libraries have.
Right.
And some of it, she said, is not because of the smallness of it, but because of the fact that, for example, and a lot of the libraries, they have a lot of computer facilities for kids. And she said, really, because the school's right there and it's close, they probably don't, that probably wouldn't be something they need in the library. But she thinks that there's a lot of things we're missing. She also said that the meeting room at the library is not being used very much. So she was also trying to make a pitch that, is there a way to get the town to use it more, or people in the community? Honestly, I've been in it, you've probably been in it too. It's not a really big room anyway. And we've got a lot of other, like the town hall, that probably satisfy the needs in many cases. But she does seem like she's very much outgoing and wants to reach out to the community. So maybe after if Abby has the next meeting, we could talk about, what kinds of things we could do.
Do you know who has historically been organizing the Wellness Wednesdays? Was that the Poolesville seniors?
That was WUMCO.
That was one.
It was WUMCO?
Yeah.
And are they still doing it? I just
That-
haven't heard of it lately.
Right. There hasn't been many this year. When it was started, we had hit or miss attendance. We've had some things that have been very well attended and some things haven't been. So one was the Narcan training was incredibly well attended. But we've had other ones that we had one where we literally only had one person. So that has been sort of put on hold right now to try to see, what there might be in the, along those lines, or if we do just the specific ones that are well attended or things along those lines.
Yeah.
Again, things about youth and students were the ones that did the best.
I wonder if, and I don't know if this is the right place to even have this conversation, but we worked hard as commissioners to get the commemorative flag policy passed last year. And as the town draws attention to certain communities each month in sort of a commemorative way, if there would be a way to link up maybe wellness issues that might be of particular interest to that community each month. So it was like we are reinforcing the awareness and events of one another.
Yeah, I think some of the wellness stuff it was trying to do different things to just see what the needs were, what their
Where the interest was, what.
yeah. I mean, if you think about it, the sort of the whole wellness initiative is only 2 years old now.
Right.
And the first year was just trying to gather information, and then last year trying different things out, like clinics, like wellness, and so it's. I would say sure, but I don't know what's going to stick and what strategy there is going forward exactly. That's come out of this. I don't know.
And I guess my one other thought was they're sort of like town events. And I'm wondering if Tara has any space on her plate to kind of be the promoter.
She should talk with
Planner.
with Melissa Wiedenhofer about if it's wellness and linking in
Yeah.
Yeah.
community.
And we can, I can touch base with everybody in town hall in terms of where we are on that and what the feeling is now. I think the main thing was, it was much more directly tied to pure health, wellness. There was one on eye care. There was one on.
Yeah, I went to that one. Yeah.
Wasn't there one on like internet safety?
Yeah. Mhm. There was
Stuff like
and
that.
was,
So
again,
it was kind of a broad
Yeah.
wellness.
right. And that one again was one that was pretty well attended, actually. That one as well. But there were also ones that were very specific health ones. And the only reason why I bring that up is just to say that was the attempt that they were trying to do then. I'm not
Yeah.
saying,
I'm saying it was just sort of
So it has petered out, or they have figured out
Yeah.
other ways to reach the community.
right. And
Okay.
so that's where it sort of ended at that point. But if there's other things that we want to look at or events that we want to look at, that we can have that discussion.
Okay. All right.
I have a couple things similar to Nancy. I was asked by Kathy of the Healthcare Initiative Foundation to set up a meeting because she wants to learn more about Fair Access Committee and what we're working on in this area. They are offer grants to WUMCO and have been. They're the ones who were the original grantees that got the sort of whole
Right.
sort of exploration of health issues. So she's interested in that, in a meeting to learn more. Also, Lynn Arndt, who had been the interim, director of the Healthcare Initiative Foundation and is now the chair of the Upcounty Citizens Advisory Board. Katie pointed out to me, she's been using that committee to bring up issues that matter to the, in particular, like there was something about the CIP this week.
Right, and that was a good.
There was
meeting.
another one that you were on about transportation.
Right.
So, and I think it would be worth a conversation. It's maybe not coming in, but similar to how Nancy talked with Abby, but have a conversation
Have
to
one of
see
us
what,
reach out to her and just.
or even have a couple people sit down with her and saying, what are you looking to do? Can we coordinate? Can we amplify our voices together?
Yeah.
Because she's on the same track as us, and she really cares about, from Germantown, or even, not even Germantown, but basically Boyd's and North, right? So that's
Okay.
not Poolesville, but it's also,
Well, maybe that's similar
Agriculture.
to like we did with Kate Stewart today. Maybe it's let's meet at locals and like talk through.
I mean, she's here at locals too, but yeah.
I think she's on the board of Riverworks as well.
Yes,
Right,
yes, and she started the Upcounty Hub, so she's,
Yeah.
I just think she's someone who's ready to be doing things, that partnering and seeing where she's going and partnering where we can would be a smart thing.
What if, my brain is still thinking about all these amazing nonprofits that and organizations we have in our area. What if each one of them took a Wednesday? I don't mean to keep pounding Wellness Wednesdays. I just think, how do we give opportunities and raise the messages, support the messages and efforts?
Yeah,
Yeah.
she and Crystal Bevins is now the UCAB head right now. And at the last UCAB, it was a discussion that was, I thought, pretty well done on healthcare too. So they've been trying to bring up a whole bunch of
Trying
issues
to
like
use
that.
that to push
Yeah.
her.
Wonderful.
So
Right.
So I can, if you want, Link, I can try to see if I can follow up and
Yeah.
connect who wants to,
Yeah.
or set something up and then invite people, or.
That would be great.
Yeah, Lynn is very good. She actually had an event in November last year that she asked us to do a briefing, and it was here at the HMD, and they did a tour first, and then they came over here, the UCAB board. And Melissa was there, I was there, so we all gave an
Yeah,
overview.
you can see.
Yeah, it was a good,
She's
good conversation.
trying to.
That's
so-
wonderful.
Okay. That's good. And Healthcare Initiative Foundation, I think I did meet her, she's the new head you're talking about.
Yeah.
Yeah.
She just she grabbed me, it was right before the AFT event.
Oh, okay.
And she had grabbed me, and then I said, hey, you should
Yeah.
introduce, because they were talking with WUMCO folks at that time, so.
Okay.
And then maybe I should just update on that too, the AFT event, the American Farmland Trust event that we had a few weeks ago. We've had a few follow-up sort of email exchanges, and there's a follow-up date to tour the Office of Ag in, it's not Boyd's, it's, thank you, Durwood,
Right,
on the 27th, February 27th.
yeah.
So anyone is welcome to join. It'll be from like 10 to 12. I'll send that date and time out to people.
All right. Two other quick things. I think you heard some of this today, but there was mention of the next operating budget testimony dates, the 7th and 8th of April. I don't know, when I'm looking at our budget issues, we got some operating issues with the pool, so we could testify, and I think we will anyway, just because the more you show up, the better. But also Black Rock Center for the Performing Arts is having on May 1st, and I think, I'm just got a note from Ruben about it, but it looks like it's the county executive holding a forum on the budget. He's hearing a series of them, but that's one. And
Similar to the last one that you did?
yeah, and it's an informative one too, because at that time, they're going to know pretty much what the budget from the state is and all that stuff, so he wants to
Okay.
have and I think it's a good opportunity for us to get as many
Yeah.
of the local groups as we can, including the swimming groups and, yeah, that kind of thing. So we got some time, but that's an opportunity too.
That one's more not about the capital budget. That one will be about the operating budget.
Yeah, although, the nice thing about those events is that that's true, but you can always
Well, you
raise
know,
an issue if you
that's
want to,
true,
that's a
right.
budget
Yeah.
issue, so, and they don't say, hey, stop, that's not a capital budget issue, so.
No, you're right
Usually
about
it's
that,
good, one way or another. So,
And great job testifying a couple weeks ago with the swimmers.
what,
Yeah, those were great.
that was great.
Nice to see Ethan's friends holding signs.
Yeah, that was great. They were really pumped up. And the nice thing about it too is that, I don't think, so Ethan and Everett is his father, Ethan's father. He said, those kids were like really jazzed up after they came home. It's really neat to go to these things, right? They really
Good to be
enjoyed it.
involved.
Yeah.
I think the more we can involve our youth,
Yeah.
we're teaching them about local civic government, how things work.
That would be great, so. All right, anything else for the, Laura, did you have anything from a media standpoint? Thanks for coming and doing all the photos today. I posted them up on Facebook, and that was good, so.
You have a look of concentration, Laura.
You
You're
do.
trying-
We can't hear you, but we can see you, so.
Let me see here. Yeah, you're muted right now, and I'm gonna try to help you, but I can't unmute you. The thing won't let me unmute you, so
Oh,
you're gonna.
okay, so it's not on our side, okay.
Yeah. So it should be at the bottom of the screen should be where it's at, but hang on, let me see something here. Okay.
It says you can't unmute, I think. You can't
You
unmute
can't-
someone else,
I-
okay.
it's
You're
that
trying
I
to do it,
can't
you're trying to do, it.
unmute
okay.
Someone else, and I can't
Yeah,
do it.
I got
That's
it.
the issue.
All right, well,
Okay.
but thank you for coming out today, I appreciate it, that was really helpful, so. Anything else for the, good of the order? Ed, I know you're on mute, so you probably don't have anything that you want to add, but if you do, before we close out? All right, anything else here?
Nope, that's it.
Can I have a motion to adjourn?
Motion to adjourn.
Second?
All those in favor?
Yes.
Thanks again, everybody. Talk to you later. Thanks, Niles. Appreciate
Oh,
it.
Ed,
Yeah.
did you have something before they
No,
jump out?
I was just saying aye with the vote.
Okay. Yep, he was recording his vote.
Thank you.
Hey, Niles,
Yes.
I have to head out tomorrow morning about 9:30 for a meeting for the rest of the day, but if you need any help with any of the language on that stuff for the committees before that in the morning, just let me know.
Yeah. I'll do something pretty early and send it over to you and say, this is what I'm going to say, and then we'll be good. Okay? All
Sounds good.
right. Thank
All
you.
right, thanks.
Bye.
Thanks, everyone. Night. All right.
It would be nice to have a sort of systematic way to
You're,
check in